ADHD and anxiety disorders are separate conditions characterized by unique symptoms and manifestations. These two conditions can co-occur, which can create challenges in diagnosing and treating an individual. Moreover, one condition can exacerbate the other. So, what defines social anxiety, and how is it different from conventional anxiety? Social anxiety is defined by a persistent fear or anxiety of being in or interacting in social situations for a period of at least 6 months. People with social anxiety fear being judged or watched by others in social settings, often causing them to avoid these settings entirely. They feel a threat of embarrassment in social situations that are not in line with reality. Common symptoms felt in social situations include rapid heart rate, redness or blushing of the face, soft-spokenness in interactions, avoidance of eye contact, and even nausea. In comparison, what are ADHD and ADD? ADHD, or attention deficit hyperactivity disorder, is a mental condition whereby individuals have trouble focusing in daily situations. Individuals with ADHD may find themselves spacing out or daydreaming during classes and other events, or may be restless, hyperactive, and fidgety during daily tasks. The symptoms of ADHD include inattentiveness, hyperactivity, and impulsivity. ADHD is mostly diagnosed in school-aged children, but can be diagnosed in adults as well. The specific causes of ADHD have not been pinpointed by scientists. While there is increasing evidence suggesting a genetic contribution to ADHD and the identification of several associated genes, no particular gene or gene combination has been identified as the primary cause of the disorder. It's important to note that individuals with ADHD often have affected relatives as well. Anatomical differences have been observed in the brains of children with ADHD compared to those without the condition. Children with ADHD tend to exhibit reduced volumes of gray and white brain matter and display distinct brain region activation patterns during specific tasks. Several non-genetic factors have also been associated with the disorder, such as low birth weight, premature birth, and exposure to toxins like alcohol, smoking, and lead. It's worth noting that the term ADD, while once used, is now considered outdated. It referred to the inattentive aspect of ADHD, characterized by a lack of focus, poor organizational skills, inattention, easy distractibility, forgetfulness, difficulty following instructions, and similar symptoms. While ADHD can co-occur with various anxiety disorders, social anxiety disorder, or SAD, stands out as one of the most prevalent. Although specific figures may differ, studies indicate that approximately 60 to 70% of individuals with ADHD also encounter social anxiety disorder. There is another perspective suggesting that the symptoms of ADHD themselves can contribute to the development of anxiety. Frequently, ADHD symptoms, which include inattention, hyperactivity, and impulsivity, can increase the likelihood of an individual being subjected to teasing, bullying, or experiencing social rejection. Fearing further rejection, many individuals tend to withdraw and avoid social situations they perceive as threatening. A person with ADHD may be more prone to developing social anxiety if they have a family history of anxiety disorders, they encounter negative social aspects such as peer rejection, bullying, or interpersonal conflicts, they possess a reserved or inhibited temperament, or they undergo abrupt social changes such as starting a new job. Once it has been established that someone has both ADHD and social anxiety, a few of the symptoms that they share include social interaction hurdles, where people affected by social anxiety disorder may grapple with difficulties in forging and maintaining friendships driven by their deep-seated fear of rejection. In the case of attention deficit hyperactivity disorder, individuals often face challenges rooted in limited impulse control and a propensity to misinterpret social cues, making it arduous to sustain meaningful connections. Inattentiveness, within the context of SAD, an individual may outwardly appear disengaged, but this demeanor is primarily a consequence of their preoccupation with worries. Conversely, individuals with ADHD experience inattentiveness due to distinctive brain differences that hamper their capacity to concentrate. Issues with task completion affects those dealing with SAD, and they may find themselves immobilized by anxiety when confronted with a task, rendering them reluctant to seek assistance. Meanwhile, individuals with ADHD may grapple with submitting assignments due to their struggles with planning and lapses in memory. There are numerous resources available for diagnosis and dealing with social anxiety and/or ADHD for students, especially at universities such as McMaster. McMaster University specifically offers services such as the Student Wellness Center, SAS accommodations, and the MAC Anxiety Research Center. The Student Wellness Center at McMaster provides a wide array of services spanning from counseling to medical care. SAS accommodations at McMaster University are meticulously tailored to address the unique needs of each student, encompassing a diverse array of services such as extended time for exams or other assessments, as well as note-taking assistance, among other forms of support. The MAC Anxiety Research Center is committed to the advancement of knowledge concerning anxiety-related disorders by employing an interdisciplinary research approach. Your family doctor plays a pivotal role in supporting your overall health and well-being. Among the valuable services they offer, they can provide referrals to specialists such as psychologists or psychiatrists who possess the experience and expertise to address a wide range of mental health concerns, including the diagnosis and treatment of conditions like anxiety or ADHD. A general practitioner or your psychiatrist can also fulfill an essential role in meeting your medication needs. Lastly, MindBeacon is an online mental health platform that provides accessible and convenient mental health support and resources. It typically offers services such as cognitive behavioral therapy and counseling through digital means, making it easier for individuals to access mental health care and support from the comfort of their own homes. The treatment options for ADHD and social anxiety often exhibit and overlap in therapeutic approaches. For ADHD, common treatments include cognitive behavioral therapy, or CBT, and the use of medications, including stimulants and non-stimulants. CBT in ADHD helps individuals develop strategies to manage their symptoms and improve their attention and focus. Medication like stimulants, for example, Ritalin and Adderall, are often prescribed to enhance concentration and reduce impulsivity. Non-stimulant medications, such as Strattera, offer an alternative for those who do not respond well to stimulants. In the case of social anxiety, treatment typically involves anti-anxiety medications, for example Xanax, and antidepressants, for example Prozac, which can help alleviate the symptoms of excessive fear and apprehension in social situations. CBT is also a valuable component of social anxiety treatment, aiming to reframe negative thought patterns and teach individuals coping strategies for managing their anxiety in social situations. There is an intersection of treatment options for conditions like ADHD and social anxiety. CBT is a common thread, as it can be effective in addressing the psychological aspects of both conditions. Additionally, non-stimulant medications, like atomoxetine, can be utilized to manage symptoms in individuals with both ADHD and social anxiety. This overlap in treatment options highlights the importance of tailoring interventions to the specific needs of individuals, taking into consideration the unique combination of symptoms and challenges they may face. There are several avenues of future research and other initiatives relating to ADHD and anxiety, such as pharmacogenomics and personalized medicine, as well as integrated treatment approaches that are being explored on the basis of the relationship that anxiety and ADHD might have. Personalized medicine is something whose efficacy is being researched in many different fields, including mental health treatments, more specifically for anxiety and/or ADHD treatments. It investigates genetic variations that are able to influence how individuals respond to medications for ADHD and anxiety, and can lead to personalized treatment plans and approaches. Medication regimens that are based on a person's genetic profile may enhance how well the treatment works, and it has the possibility of reducing side effects. Integrated treatment involves studying early identification and intervention methods for children and adolescents who are vulnerable to ADHD and anxiety. Recognizing early indicators and applying specific interventions can help alleviate potential long-term effects, as well as can enhance prevention efforts significantly.